Good evening, everyone. A very warm welcome to all of you to today's session. Um, this is the quintessence of being, examining existence and experience online course organized by the Consciousness Studies program, the National Institute of Advanced Studies, Bangalore. So today we have Dr. Pushya A Gautama. She's a medical doctor. She will be speaking to us about the topic, how does Ayurveda understand existence in being, perspectives from a long distance lens. So a few words about Dr. Pushya. She has done her schooling from the Krishnamurti Foundation and her undergraduation and MD from SDM College of Ayurveda, Hospital Hassan. She is a rank holder and university gold medalist for both undergraduation and MD. Currently, she's a project consultant at NIAS CSP under Professor Sankita Menon. She's also a doctoral scholar now. So a very warm welcome to Dr. Pushya, and I welcome you to give the presentation.
Thank you so much, Meera. It's an honor to be a part of this course. So before I begin, what I'll do is I'll maybe just talk for 1 or 2 minutes, and then I'll switch off my video and then share my screen. So, and then after that, I'll come back on after the presentation is over. So first, I'd like very much to thank Professor Sangeeta Menon for curating this opportunity, for conceptualizing it. And I also want to thank Meera, who's the coordinator of this course, for bringing it together so beautifully. And let me just share my screen now. And So is my screen visible?
Dr. Pushya, just enable editing and just do full screen, please.
Is it not visible now?
It is visible. You can just enable editing and you can just full screen it.
I have made it full screen. Okay. Enable editing. Share screen. Okay.
Yeah, just slideshow. That's all.
Is this okay?
Yeah.
Okay. Thank you. Okay, so what I'm going to be talking about is basically how Ayurveda understands being. And I thought that was a very, very interesting topic. And I've also really enjoyed thinking into this, having never really thought about Ayurveda from this lens before. So let me first begin by briefly introducing Ayurveda. So Ayurveda is a 5,000-year-old Indian system of knowledge and medical practice that originated from a wide and diverse local health tradition across the Indian subcontinent. And the texts of Ayurveda are essentially compendiums of this rich and diverse knowledge that the Indian subcontinent give birth to. I can speak a little more about Ayurveda, but I thought maybe I'll just go directly into the topic, and maybe after the lecture, if there are any questions or anything, we could discuss that further. So let me now begin by talking briefly about how Ayurveda understands this concept of being. So looking at the Sanskrit word for being is astitva. This is just an interesting fact that I thought I could begin with. So astitva basically means to be, or being is astitvam. So astitva is basically derived from the Sanskrit root as. Okay.
And Dr. Pushya?
Yeah.
Sorry to interrupt you. Can you still do the enable editing part? It's still not full screen. Just enable your editing and you can just do the slideshow.
Okay. Oh, is it not full screen? Sorry, just 1 minute.
Yeah.
Can I just stop share and then come back to that?
No. You can just enable editing here.
But I am clicking. Oh, okay.
It just
Is it
slideshow.
okay
That's
now?
all. Yes, it's perfect.
Okay, thanks. So this term, the Sanskrit term for being is astitva, and it comes from the Sanskrit root as, which is to be. Interestingly, the English term is also is, and the Latin term is est. So you can see that there are similarities in this root as well. And linguistically, it might be interesting. When I was just researching the roots of astitva, I came across this, and I thought it was quite an interesting finding that across geographies and across continents, the roots seem to have been the same. So, coming back to how Ayurveda understands this concept, the term Ayurveda may be broken down etymologically into two different words, that is Ayus and Veda. And Ayus basically means life or living, and the term Veda, as some of you may be aware, means to know or knowing, to inquire into, etc. And thus, Ayurveda literally translates as the inquiry into, or the science of, or the knowledge of life itself. Now, this definition is particularly relevant in terms of a medical science or to a medical science for particularly two reasons. One, it understands that diversity of disease and disharmony are as diverse as life itself, and therefore they are unique to each and every life form and cannot be standardized, just as life is not a standard. Secondly, it indicates that health or well being is not merely a function of lack of disease, but a conscious act of embracing good health. True health is not merely an act of moving away from disease and death, but an act of moving towards harmony and well being. It is unsurprising, therefore, perhaps, that when elaborating the purpose of Ayurveda, Charaka, the author of the Charaka Samhita, which is a nodal text of Ayurveda, says, Prayojanam chasya swasthasya swasthya rakshanam aturasya vikara prashamanam, which translates as, the purpose of this science is first and foremost to protect or conserve the well-being of the healthy, and only then to cure the disease of the diseased. And so it's evident that when first looking at even the science of Ayurveda itself, there is a very large part of, there is a very significant focus that is given to understanding the dynamics of health and then of disease. And it is obvious that this science of life is based on a very fundamental understanding of being. For it is only possible to facilitate well being if one understands essentially what it is to be. So the term Ayus, is mentioned earlier, refers to an individual's state of being, as mentioned earlier. And Ayurveda defines Ayus, this state of being, very interestingly. So it consists of four parts: the sharira, or the form, or the physical body, when speaking about the human being. And today, because I'm speaking about it also in the context of how we understand this in practice, how is this concept applied when actually dealing with individuals? So because of that, I'll restrict myself to looking at how this concept of being is applied, maybe in a clinical setting or in life settings. So there are four components when understanding this term ayus, or this term being. There is a sharira, which is a form; indriya, which refers to the sensory perception or tools of sensory perception; sattva, or the mind or the consciousness; and also the atma, or the life force. So sharira, indriya, sattva, and atma, all of these. So when I say atma is a life force, I mean that it is an enlivening force. It is what enlivens all the other three. And basically, when all of them come together, the sharira, the indriya, the sattva, and the atma, when they all come together, then that is what it means to be alive. And therefore, perhaps the definition of ayu, as mentioned by Charaka, sharira, indriya, sattva, atma samyoga dhari jivitam, nityaga, anubandha, and these are just synonyms. So to be alive in this world, that is to be in this world, there is necessarily a coming together of four entities of a body, the sharira, the tools of sensory perception, the indriyas, the sattva, which is the mind or the consciousness, and the atma, which is an enlivening force, the life force, or that which enlivens all of the others. It is only when all of these come together that there is a being that is possible, and this being is what is called Ayu. If this then is being, it follows that every individual, every life form has a different matrix. Every life form is different. In fact, none of us share the same forms. There are very few identical twins, and even they are only identical in form. There are so many differences that they have in terms of the personalities that they are. So it is impossible for any one individual to replicate another, any one life form, any one human being to be identical to another. Thus, health or well being is a dynamic harmony established between these rungs: the body, the mind, the world, and the life force. It is impossible, therefore, to prescribe health. There is no prescriptive benchmark. If individuals are not identical, their health states cannot be either. An individual state of health, therefore, is his or her own unique state of balance. And I'm going to go on coming back to this concept of balance because in Ayurveda, this is perhaps the pinnacle of health. When we speak about balance within an individual, we speak about balance with respect to an individual. And again, this balance is unique to that person. So, how do we then understand this concept of balance? So, in Ayurveda, when we look at the term health basically derives from the word swasthya or swastha, which means a healthy person is referred to using this term. So, what does it mean, and how does balance figure in this concept? So, when there is a balance between the doshas, and the doshas are the functional building blocks of the human body, and they are the vata and pitta kapha, and Ayurveda understands these as being the functional building blocks of the body, the dhatus, which are the structural building blocks of the body, agni, which is the metabolic profile of the body, the manas, which refers to the mind or the consciousness of a person, atma, which I spoke about earlier, which I refer to as the life force or that which enlivens and causes a state of living, and of course the indriyas, which are the sense organs and also the sensory perceptions that result from from the indriyas. So when all of these, dosha, dhatu, agni, manas, atma, and indriyas, when all of them are in a state of balance, and this is the term that Ayurveda uses to describe them, and samadosha, samagni, samadhatu. So these are the words that are used in the definition of swasthya. So samadosha, samagnishcha, samadhatu, malakriya, prasanna atmendriya manas swasthetya vidhiyate. That is how the classical reference to this concept goes. And I would particularly like to highlight this term sama because the equivalent of well-being or health, when speaking about it in the context of Ayurveda, is particularly referred to only in this way, as samatva or as balance. There is no other reference or a prescriptive standpoint to how people should be. And this actually forms the basis of how one understands a being. So since a being is understood as a function of the balance of all of these various entities, it follows that even when looking at the person to assess their disease state, when assessing a person, even just simply assessing a healthy individual, one is not looking at them in comparison to another, but one is only comparing them to themselves, to a base state that is their own state of personal, unique well-being and harmony. So then, now that I have introduced this concept of samatva or balance as being the keystone of discovering well-being, how does one go about practically evaluating these? That is the next question which I will attempt to answer. So on the basis of this, Charaka, as I mentioned earlier, evolved tools to A, identify a personal health benchmark. 2, to assess the degree of deviation from that personal benchmark. And 3, then to discover steps and also work with the patient to restore that harmony that the person uh, intrinsically possesses. So this is basically how Ayurveda works around this understanding of samatva as the keystone for well-being, as I mentioned earlier. So I will now, I think further, now that I have mentioned how the process of assessment and treatment in Ayurveda goes, an identification of a health benchmark, assessment of the degree of deviation from that benchmark, and further steps to restore harmony and move back to that particular benchmark. So how is this done? There are several tools, as I mentioned, to assess this degree of, to assess what is a person's unique health benchmark. There are several of them, and I will elaborate the others later on. But today, because particularly when we are speaking about an individual's being, I thought I would bring about this concept of Prakriti. And Prakriti is something that is a very important Ayurvedic evaluative tool. And it is something that all treatment and also all assessment of an individual is significantly based on. The other tools I will elaborate later, but I thought in this context, it might be interesting also to introduce this because it is also something maybe that we could discuss and also interactively discuss over the course of this presentation. So Prakriti is an assessment of an individual's body-mind constitution. It involves the assessment of the balance of the three doshas, which I mentioned earlier, with the functional units of the body. It involves assessment of skin type, hair type, physical build, diseases that he or she may be prone to, comorbidities. That is, if a person presents with a particular disease, what are allied symptoms and clinical presentations that are likely to be found? What is the nutritional status of the individual? What are their preferred diets? What are their emotional predilections, etc. So there are over 235 predictors for each of the Prakritis. But of course, in a clinical setting, it is impossible to assess all of them. And while the degree and the depth of the Prakriti assessment vary from clinical setting to clinical setting, there is certainly some assessment that goes on, whether formally or informally, in almost every clinical setup that I have come across so far. So according to Ayurveda, there are 7 basic Prakritis. They are the Vata Prakriti, Pitta, Kapha, and then there are the combination. These are the dominant 3 based on the 3 doshas. And then there are combination Prakritis that are the Vata Pitta, Vata Kapha, and Pitta Kapha. And then there is a combination Prakriti, a combination of all 3. That is Vata, Pitta, and Kapha. Now, it is important to remember that these are gradients, and even within the Vata, there is a gradient that can be established. Within the Pitta, there is a gradient that can be established, and these are not rigid structures, but fluid. And clinically, it is far easier to see this than theoretically, but these are just broad pointers to give us an idea of the person whom we are dealing with, also to give us an idea of ourselves sometimes. So let me now pick up some specific Prakriti traits, which I thought might be interesting to discuss. And maybe, one could just do this exercise where you ask yourself, which one would I fall under? Would I fall under any of these at all? And if not, then that would actually be quite interesting to discuss after this is over. So specifically speaking about, let me start by maybe talking about physical characteristics like hair. So if one was to look at the Vata Prakriti, I'm sorry, I wanted to find, I would have preferred Indian pictures, but since they were not available on the internet, I've just picked whatever I got. So when looking at the Vata Prakriti, the hair tends to be very thin, scanty, and dry, and also tends to be associated with a lot of hair fall. So Vata Prakriti people generally are used to a lot of hair fall. Whereas in the Pitta Prakriti, the hair is not really as scanty as Vata, but it cannot be called thick hair. And often in Pitta Prakriti individuals, they bald easily, and also their hair grays very easily. Some of you might have noticed uh, in yourselves or in people near to you, your friends, that sometimes graying starts as early as 15 or 13, or even younger, maybe 18, 19. So those are all, I mean, typically characteristics of the Pitta Prakriti. Of course, the Kapha Prakriti has thick, very dense and lustrous hair. So that is one of the keystones of the Kapha Prakriti. And this is not something that is cultivated, but this is something that generally the patient is born with, or the person is born with. And so these are the three hair types often that are found. And it is not necessary that one person always sticks to one or the other. And you can find that there are mixes of different traits. It might be soft, but it might be scanty, which shows that there might be vata and pitta. So these are not the only traits, but there are other traits as well that you would use as guidelines and pointers. So the second, maybe one area that could be spoken about is the BMI, or the body mass index. Now, while the body mass index concept has not specifically been mentioned in Ayurveda, there have been studies that have attempted to link the morphology or the anthropometry of different individuals to the Prakriti concepts. I myself was part of one such study. And I find that clearly, yeah, there can be some correlation that is established between body mass index as well as the hip circumference, the chest circumference, the mid arm, the mid thigh circumferences, etc., which progressively increase from the Vata to the Kapha Prakritis. So the Vata Prakritis tend to have a very low BMI, that is their standard, and generally tends to be between 19 and 21. The Pitta Prakritis tend to be slightly better built and have a BMI of 21 to 23, whereas the Kapha Prakritis are naturally plump and very well built, and they tend to have a BMI of 24 and above. This is, of course, a representative sample from the study that I was a part of. I have seen a couple of publications that also corroborated this. But if a Kapha Prakriti individual, let's say, is not about 24, but 23 or 22, that would not be very surprising either. But this is a trend, and this would be acceptable in the different Prakritis. So often, I think this is one thing that I have seen often in patients who, I mean, or people who think of themselves as very obese and want to lose weight. I found at least 20 to 30% of people who really want to lose weight need not, because their weight is really not giving them any trouble, and it seems to be their natural base state. And I think maybe this understanding of the BMIs and the Prakritis might help facilitate a greater acceptance of a body that may not be thin or lean. The third area again would be, I will come to the mental characteristics as well a little later. The third area again, which is commonly seen and can commonly be identified with, is the skin. So often Vata individuals tend to have very dry skin, and one good measure of this is how frequently does that skin need to be moisturized. Often Vata Prakriti people, whether it is winter or summer, require some form of moisturization through the year. Whether it is coconut oil or whether it is some other moisturizer, they generally tend to need that in order to prevent cracking and also dryness of skin. Pitta Prakriti individuals, not so dry. However, they tend to need moisturizing only in the uh, colder seasons, in the winters, whereas in the more humid climates, that may be monsoon or summer, it just depends on humidity, they don't tend to require that much moisturization. In contrast, the Kapha Prakriti has uniformly oily skin, and which is particularly, I mean, it aggravates in the form of pimples, etc., in the summer months. And in the winter months, they require absolutely no moisturizing or very little moisturizing because of the natural oil content of their skins. So in terms of sleep again, one finds, I don't know, I certainly found that when I was studying this, I could really identify with it, and also among people, my friends and my family. Vata Prakriti individuals tend to sleep very light and also tend to wake at the slightest disturbance. And also they experience sound sleep for only around maybe 4, max 5 hours, and tend to wake very early, let's say around 3 or 4, in the morning, and after which they tend to have very disturbed sleep. I have seen this in some individuals, and I have found that this does correspond exactly to how one may understand a Vata Prakriti. In contrast, a Pitta Prakriti and a Kapha Prakriti person would sleep more soundly. Maybe a Pitta Prakriti people generally tend to sleep late and wake late. That is generally the tendency that is observed. Whereas the Kapha Prakriti individuals are individuals that require a set amount of sleep. For instance, there are some people who you might have heard say, I can't do without 8 hours of sleep, or I need my sleep. And that is again one of the most important features of the Kapha Prakriti. um, in terms of movements, again, one finds when people talk, sometimes you find that some people speak very animatedly, even when they are speaking to you about their condition, or they're telling you something, even something innocuous. One finds that some people tend to gesticulate a lot. For instance, I tend to gesticulate a lot when I speak. So that is again a very common finding among the Vata Prakritis. Whereas in Pitta Prakriti, there might be a degree of gesticulation, but it is measured in far less. And Kapha Prakriti individuals uh, hardly gesticulate. There is a very measured, deliberate change in posture. Any movement they make, there seems to be a certain deliberation behind it. And I'm sure that you would have observed this, even if you watch some people just speak on TV, you watch a serial, you watch different things. It would be quite interesting to look at their body movements and get a sense of how they are. Looking at mental states, often Vata Prakriti individuals are prone to mood swings. And when I say they're prone to mood swings, I mean that uh, an individual who's intrinsically Vata, I'm not saying that the other Prakritis are incapable of experiencing mood swings, but I'm saying that maybe in Vata Prakriti individuals, this finding is more common, and also it does not need to be acquired. It is something that one tends to flow into easily. And such individuals are also prone to anxiety and depression. When I give you this example, you might be able to understand this a little better. Some people, for example, stress naturally over exams. If one takes an exam as an example, it's very easy to find people who react to it differently. Some individuals will tend to stress out over the exam almost all the time, whether they have done well, whether they have not done well, whether they have studied, not studied, whether they're good students, bad students, without that mattering at all. There will just be a certain degree of panic that one experiences when placed in a pressure situation. Such a reaction is almost always characteristic of an individual who is a Vata Prakriti individual, or someone who has an abundance of Vata. In contrast, not in contrast, Pitta Prakriti individuals, on the other hand, are quick to anger, and they're also very passionate people. So often these people would be described as the life and the soul of a party, or somebody who, with their enthusiasm and their flamboyance, can take people along with them. And I think there are many leaders who are perhaps Pitta Prakriti individuals, many who are not as well, but certainly the more flamboyant ones might be. Also, these such people tend to anger fast, but they also tend to um, uh, their anger drops off as well quite fast. So I'm sure again you would have seen this, that people, um, amongst your own relatives or amongst your own friends, perhaps you yourself, um, might get angry, might get irritated very easily, but then you don't hold on to it and then let it go very fast. So just as easily as you get angry, you can also cool down and calm down. In contrast, however, Kapha Prakriti individuals um, are slow to anger. Their anger does not quench easily, and they're also not very prone to emotional outbursts. They don't approve of emotional outbursts. They prefer to remain, relatively passive and observe things. But they are also the kind of people who hold on to grudges, that they don't really get moved or shaken very easily, but when they do, it is not something they forget easily. Again, this is something we might see in ourselves, and that just refers to the fact that we're all anyway a mix of all of these things. The question is, what is a base state, and to identify that base state and then to move from there in terms of therapy if needed. So in terms of memory, again, it would be quite interesting. because Vata Prakriti individuals remember fast and forget fast. These are the kind of individuals who say, yeah, they're able to cram before an exam, do rather well after the exam, but then after that, after the exam, you ask them a question, they'll be unable to reproduce what they'd studied. So this is again one of the cornerstone findings of somebody who's a Vata Prakriti. The Pitta Prakriti individuals tend to grasp fast and also retain long. So they are the ones who tend to also excel rather easily at academics. I mean, academic achievements come rather easily to them. In Kapha Prakriti, individuals grasp slow. So they might not be able to keep up with the class or with um, the pace at which, let's say, another smarter kid, smarter within quotes, might go. However, these are the individuals who, if allowed to study at their own pace, will retain things for far longer than any of their compatriots or colleagues. So this is again the memory retention pattern that is often observed. So as I mentioned earlier, in addition to Prakriti, so these were just some examples that I gave in order to demonstrate how in a clinical setting, or in not necessarily a clinical setting, when attempting to look at an individual or look at oneself and assess where one is, these are some questions that can be asked. And it is important, especially because these questions, it's possible also to say, yeah, I learned, I might not naturally have a fast, I might not naturally be a quiet and contained and unemotional person, but it's something I've had to learn, and life has taught me to rein in my emotions. Now, often these things, I'm not, when one looks at Prakriti, one is not looking at acquired traits, one is not looking at acquired attributes. And one good way that we often, one good way of doing this, or at least a way that is often employed in clinical settings, is to ask someone to recall not how you are now, not how you were 5 years ago, but how you were maybe when you were a child, as early as you can remember. What have people said about your childhood? What do you remember of how you were when you were 5, 6, 7? And it is often interesting how much and how deeply people remember that time of their lives, and that is often a good way to assess a benchmark about and get an idea of what their Prakriti might be. The same questions again will come later with more detail when attempting to assess the degree of deviation, but I'm not really going there because I wanted to focus on this, because in order to understand being oneself and understand being, I thought maybe focusing on Prakriti might make sense, and also to understand how to evaluate this benchmark of ourselves and our own well-being uniquely. So like I said, other than Prakriti, there are other assessments as well. There is something called the Sattva Pariksha, which is basically a detailed examination of an individual's psyche. For instance, what makes an individual angry? Is he or she extremely excitable? How does such a person approach conflict? How does such a person react under stress? So while some part of it is mentioned, there is certainly a degree of overlap with the Prakriti analysis. This is deeper and done with more depth as and when required. Another analysis is the analysis of Agni, which is basically an assessment of an individual's metabolic profile. And the metabolic profile is assessed using various tools, some of which involve physical examination, some of which involve questioning. For instance, what is the kind of food that you have? How often do you feel hungry? Are you able to digest what you eat? And how long does it take for you to digest the food that you eat, etc., etc. Again, there's an important concept here, and I think this again speaks about an Ayurvedic understanding of balance in a very patient-centric context, because there is a certain focus which is given to this concept called Satmya, which basically means habituation. And assessment of habituation basically looks at if a person, what has the person become habituated to over the course of their lives. For instance, if a person was born in a humid place like Chennai and then spent the rest of their lives, spent only a couple of years here and then grew up in Uttaranchal or Dehradun or a place that was much colder, then automatically their body would have certainly developed mechanisms, though perhaps not intrinsically, certainly the body would have adapted to a colder climate. The metabolic profile would have adapted, the skin would have adapted, the body itself would have adapted. And so it is important to also get a sense of how the person has interacted with their environment uh, in order to be able to um, intervene in a truly meaningful manner. And I think the point is that, again, one does not consider the individual in isolation, but you also consider the individual in a larger context, or at least in the context of their larger environment. And another area which, again, I think is quite commonly used in Ayurvedic practice is an understanding of seasonal variations. And here it is not the chronological seasons, but more the features of seasonality that appear. So even if it is technically not a monsoon season, but it is raining as if it is the monsoon, then that is how it would be considered. So there are definitely season-specific variations and dietic variations, medicine variations, and maybe let me just give you an example of how this might play out in a clinical setup. So let's say a person who I have assessed, or the physician is assessed, or has been assessed as having a Vata Prakriti. If that person comes to a clinic or comes to a doctor, now how would one go about it? What are the things that one might recommend to that person? Now, often the clinical presentations of someone who is a Vata Prakriti, I'm just giving you a standard, very commonly found presentation, is joint pain and crackling joints, because they tend to be so thin, and also very tend to have very compact physiques. um, Audible sounds from the joint, for example, when moving the joint or when rotating the shoulder, this is something that one finds very often in Vata Prakriti individuals. Now, often this can be associated with a lot of things like reduced intraarticular fluid. They tend to have they tend to also be more prone to diseases like osteoarthritis for this very reason. And so joint pain is a common presentation in someone who has Vata Prakriti. So, for instance, if I was the physician, the first thing that I would say is, okay, you are a Vata Prakriti individual. Now, what is the season in which you have come? So, if the season is the monsoon, again, the monsoon was a time when the Vata dosha tends to be high in the body. So, again, one would really steer away from giving that individual any foods or any medicines that tend to aggravate Vata. Secondly, if it is the monsoon and some physical therapy is required, then certainly one would not want them to come during the early morning or the late evening, which would be possible, say, if it was the summer. But you would say no, because this is how the world is at this point in time, this is how the season is acting, and because the monsoon is also not helping in the early morning and the late nights are colder, and those also contribute to an increase of vata, then treatment or therapy around those times would not be possible. So even in a small way, I mean in an extremely patient centric way, it becomes important to take, and again, what is the patient eating? Is the patient having an entirely roti or dry food diet? Is the patient having some ghee or milk? How does the patient process ghee or milk? Is the person lactose intolerant? If so, what are the alternatives that we can give? Because often in Vata Prakriti individuals, just a daily supplement of ghee can work miracles. So these are all things that one will have to consider when looking at a patient, not just the individual or his own presentation, but also seasonal variation, also time of day considerations, also habits and other um, uh, other things that the individual has become acclimatized to. So all of these need to be taken into consideration before really attempting to do anything or intervene in any way. And therefore, I think it becomes evident from this that when assessing well-being or when attempting to look at balance, it is not only the individual, but there are other considerations that are also involved. So basically, I just now briefly like to speak a little bit about how one assesses. Now that I think maybe I've given a little bit of an understanding about how being might be understood in a clinical context in Ayurveda. That's very brief, and I've just attempted to provide an overview with specific focus on the concept of Prakriti. There are also ways, like I mentioned earlier, of assessing the degree of deviation from the said benchmark. And the first of them would be to assess cause. And cause is often multifactorial, it's layered, it's complex. And I mean, I can maybe give you an example from my own life. So a couple of months ago, there was a boy who is just 16 years old, and he suddenly had a panic attack. And he'd been having repeated panic attacks, and his parents and him both live in the US. And he'd been advised immediately to go to a psychiatrist, and the psychiatrist within 2 or 3 sessions had already put him on some kind of medication. And it was then that his parents, his grandfather actually spoke to me and said, is there anything that you can do from Ayurveda? We don't really want our child to be on psychiatric medication for the rest of his life. He's only 16. So when I spoke to him, I mean, because I wanted to speak to him aside from his parents and anyone, I mean, it was quite clear that he just had some sort of problem in school. He'd had an issue with uh, uh, one of his friends, and that had really caused some sort of an upheaval for him. He had a problem, his academic performance, because he'd been the topper up till then, had dropped. He was also part of the school soccer team, and his performance there had dropped, and he'd gotten injured. And basically all of this put together, I think, was something that contributed a lot to his panic. And I think someone that he liked did not like him back, and there were all kinds of things that worked at that point in time. And therefore, and the other thing is, there is also a hereditary component, because his father has also been on anti-panic medication. His father worked in Wall Street for several years and has been on medication for almost 20 years now. So is there a certain familial predisposition? Perhaps, most likely there is. Are there other causative factors that are at work? Yes. Does he have a respiratory predisposition for him to get breathless every time he has a panic attack? Certainly. So in order to be able to intervene in a meaningful way, one has to understand the complex and layered mechanisms that underlie any clinical presentation. And it is only from there that uh, that that any assessment of deviation from this health benchmark can be initiated. Second is, like I mentioned earlier, an assessment of the metabolic profile. I gave a brief idea about how that can be done. And how it has changed from earlier till now. That is how one assesses how far it has changed. Also an assessment of habits. For instance, what are things that I'm habituated to? Have I become habituated to, say, drink or liquor or smoking or drugs? So these are again things that one will have to assess before. And like I mentioned earlier, seasonal variations. And the biggest assessments will also be, what is, like I said, what are the causes, what are the prodromal symptoms, what are the symptoms that appeared before full-fledged manifestation of the disease, and then what were the final clinical presentations. So these are various ways, and then one would attempt to establish a pathophysiology based on all of this. So like I said earlier, and I would really like to conclude with this point, that in Ayurveda, this understanding of being, which is essential to this baseline understanding of well-being, is very closely interlinked with this concept of balance. There is nothing further or nothing beyond understanding samatva or balance. And I thought maybe I could end with a very beautiful Zen story that I came across that speaks about the balance that one establishes between all the various entities, the body, the mind, the life force, and also the balance between the physician, the patient, um, the, 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 the therapeutic protocols, the support systems, uh, which include family, uh, infrastructure, the nurses, etc. So at every stage, there seems to be this recurring theme of balance, how one comes back to balance, whether within oneself and also in one's interaction with the world. And I thought the story very beautifully summarized this concept, and I would like to finish with that. So there was once a pair of acrobats. The teacher was a poor widower, and the student was a young girl by the name of Meda. These acrobats performed each day on the streets in order to earn enough to eat. Their act consisted of the teacher balancing a tall bamboo pole on his head, while the little girl climbed slowly to the top. Once at the top, she remained there while the teacher walked along the ground. Both performers had to maintain complete focus and balance in order to prevent any injury from occurring and in order to complete the performance safely. One day, the teacher said to the pupil, "Listen, Meda, I will watch you and you watch me, so that we can help each other maintain concentration and balance and prevent any accidents from occurring. But the little girl was wise, and she answered, "Dear master, I think it would be better for each of us to watch ourselves, for to look after oneself means to look after the both of us." I will end on this note. And yeah, if there are any questions.
Thank you, Dr. for that beautiful talk. We will take questions if there are any now. So if you have a question, please put it up on the chat box and we'll be taking them. I cannot see any questions. Are there any questions today? If anybody has a question, please read up.
Maybe I can ask a question and then people can
Sure,
respond.
sure. Absolutely.
Okay. I think there's some question.
Okay. So Dilip, would you like to ask a question by yourself? Okay. So, yeah, there you go.
Yeah, I just wanted to know whether the Prakritis you mentioned are inherited from parents.
Inherited factors, that is, genetic factors, certainly play a role in the Prakriti of an individual. And in Ayurveda, this is called the Mata Prakriti or the Pita Prakriti or whatever. But there are other factors also, like Kala Garbhashaya Prakriti, which is basically the nature of the mother's womb at the time that the baby was in it. Ahara Vihara Prakriti, which is basically the diet and the lifestyle and what the mother felt when all the feelings and the various things of various emotions of the mother. And then there is Jati Prasakta, which is basically Jati Prasakta and Kula Prasakta, which is basically race traits and familial traits, which certainly contribute to the Prakriti. So there are several factors. Inheritance is certainly one of them.
Okay, thank you, Dr. Pushya. So Kanya, do you want to say something?
Hi, Dr. Pushya. Thank you for the wonderful presentation. It was very informative for me. I would like to know what are the natural remedies or your opinion towards how to increase our immunity power, especially during this pandemic. Like, what are the food we need to include it in our diet?
This is, I think, thank you, Sukanya. I think it's something that everyone is interested in at this point in time. It's something very important also at this point in time. So I think there are some things that um, it might safe for people to have, provided that, I mean, they're not diabetic or they don't have other issues. For instance, I could say, like, there is something called guduchi. I'm sure you might be aware of that. Tinospora cordifolia. It's called chittamride or amride. It's called amride in Malayalam. So like these leaves, and especially right now, there's a lot of interest in guduchi because of its immunomodulatory property. And it is something I think that a lot of people are having. Similarly, ashwagandha. Again, there are some studies being done on ashwagandha, which are certainly helpful. And so I think broadly, when we speak about improving the body's capacity to resist disease, giving the body some more vitality, I think definitely things like ashwagandha would be good. But again, I'd say this with some caution, because especially guruchi tends to be hyperglycemic. So, sorry, yeah. So in patients with, let's say, who are already on anti-diabetic medication, maybe that should be taken with a little caution. So it would vary from person to person, but generally, yeah, I think ashwagandha is good, guduchi is good. I think particularly at this time to have um, green leafy vegetables to, I think, also to keep the body and to also what are the other foods that one can have? I could mention some Ayurveda supplements. I mean, certain medicines that I can think of. But other than that, the best thing would just be to have a healthy, wholesome diet and, you know, steam, drink warm water, stay away from outside food, that kind of thing. Yeah. Uh,
Thank you, Dr. Pushya. We have a question from Manu. Manu, would you like to ask your question?
Hi, can you hear me?
yeah.
Hi. So I was about to ask how aligned is Ayurveda principles of balance between everything aligned with endurance training? So, for example, like long distance cycling of 200 kilometers or running a marathon or triathlons like swimming, but very like extreme high endurance. Can these Ayurvedic principles be used to develop such endurance professionally? Because they use a lot of modern techniques, like yeah.
Very interesting question. Thank you, Manu. Uh, I find that definitely it is possible, and I find especially that at least in my interaction, I have also from my interaction with my Kalari master, and that certainly Kalari has which is a martial art form which does require an enormous amount of endurance, and at least the ancient the I'm sorry, not ancient, the traditional Kalari masters certainly are, I think, masters of Marma and Ayurveda.
Mm-hmm.
And so certainly I feel that Ayurveda definitely can be used for endurance training. And the other thing is also clinically, I mean, I myself have I was of course not the treating physician, but I did see a person who had completely lost, I mean, they had completely removed the knee joint, and then because the person was very heavily diabetic, the knee joint had splintered,
Okay.
and they had already suggested an amputation. And the
Oh,
knee was entirely, I mean, they did not need to do anything, that there was no surgery done, but the knee was entirely rebuilt. Or, I mean, just the muscles and the tendons surrounding the knee um, were built to support the leg. Uh, so I have seen this done. So certainly, I think, I mean, if one was to build endurance and use Ayurveda for that, that would definitely be possible.
so I want to ask one more thing. Is like so when anything goes extreme other than normal, for example, a normal person can run so much without getting tired, but some people can run for 50 kilometers, 100, 200 kilometers, and so on, ultra marathons. So, in Ayurveda or in these circles, would you classify it as a siddhi or something like that? Does it go to that zone of classifications? Sorry, I can't hear you.
Yeah, am I audible now?
Yes.
So I don't think it would be called a siddhi. I mean, that is not how it would be. But certainly that person would fly in the sense that I mean, one doesn't see such stamina easily, or one does not obviously see it. That there might be other explanations for that certainly true. That
Okay. Okay. So siddhi is something totally different, is it?
we don't I see in texts of Ayurveda one doesn't hear too much about uh, siddhis, but I mean, we don't really speak too much about siddhi, but
Okay.
it that there is certainly a spiritual element to this understanding, because if one was to look at Ayurveda itself, you have dharma, I mean, dharmartha kama mokshanam arogyam moolam uttamam. So for in order to live a dharmic or a balanced life, and in order for also some spiritual growth to happen, without basic health, that cannot happen. So there is certainly a orientation towards a larger, towards a higher, towards something, um, towards a spiritual higher, but not solely about siddhi.
Sure. Thank you.
Okay.
Okay, thank you, Manu. Shankar sir has a question. Shankar sir?
Yeah, thank you, Dr. Pushya, for the excellent talk. I have heard that poets tend to be of Vata Prakriti. Vata adhika hi purusha kavayo bhavanti. What would be the Ayurvedic explanation for this? And another question is regarding the Siddhi. I think the Ayurvedic texts mention about the Chaya Purusha Siddhi of the doctors, of the physicians, by which they can give a prognosis of the person's life.
So that is not sorry.
Yeah. So, yeah, can you tell a little bit about this?
Sure, sir. Sure. Thanks for the question, sir. The first is okay. I'll answer backwards. So Chaya Purusha Siddhi, insofar as I'm aware, in fact, it is spoken about in the Indriya Sthana of the Charaka, of Sushruta, etc., where they speak about how looking at the irises of a patient, or looking at the nature of the shadow, or looking at an aura in the patient, they're able to see something. It is not an aura, but it is there is an intuition that one gets when one nears the patient. So I don't think it is a siddhi as much as a learned intuition. I don't know if that makes sense.
Okay.
But because I've seen this actually not only in Ayurveda physicians. I mean, I've seen this in some extremely experienced physicians from, I mean, homeopathy as well, from allopathy. That, I mean, there are some physicians who are able to give you a very clear idea of where you stand, and able to give a very clear prognosis. I mean, something that even experts have not been able to do. So I think it's just something that, I mean, for instance, like if my grandmother had leptospirosis or whatever, and she was steadily, so many of the symptoms were there and nobody was able to diagnose it. We took her everywhere. This was, I think, when I was like in school. And we took her to the family doctor. He was an allopathic physician, and he's just a, I mean, he didn't have a big set, he didn't have anything, but he looked at her, he didn't do any of the big tests, and he was still able to say what it was and exactly how long she'd had it, what needs to be done.
Okay.
And all of that. So I would think that it's more of a learned intuition. And the Vadadika hi kavayo bhavanti. Actually, if one was to look at an Ayurvedic, I mean, how one looks at the Vata Prakriti, you certainly have Bahuvak. They speak a lot, Bahuvachanaha. And also often the Gandharva Kaya. I mean, when people speak about different Kayas, you might know, sir.
Yeah.
The Gandharva Kaya. The Gandharva Kaya, the people who are extremely inclined to artistic pursuits, often, I mean, such as all the Veena, all of them. I mean, Veena, Mridanga, Kaviyaha, all of that. So all of them often come under the Vata Prakriti, or the Vata Prakriti is mentioned also in that context, and they are mentioned in this context.
Okay.
So,
thanks a lot.
Thank you, sir.
Thank you, Shankar sir. We will now take Guru Prasad's question. Guru Prasad, can you ask your question?
Yeah, thank you. Sorry. Thank you, Pushya, for the excellent presentation. So I just wanted to know that whether our Prakriti is has an associative effect, like people around us, how it will affect our Prakriti, and so that which Prakriti would be like in a group, how would the dynamics work of different between interaction between different prakritis? So, and can we change our prakriti? Is it like, I mean, I got it that it is something inborn, but is there a possibility of changing?
Thank you. That's a really wonderful question. Um, I, no, see, the idea of Prakriti is that it can't be changed. That it comes with you when you're born. And so can a Prakriti change? Often not. But this concept of Vikriti is, I think, what you're speaking about, which is a deviation from the Prakriti. And it is not necessary that the Prakriti is always good. It's just that that is the base state. And for instance, if a person who has a Vata Prakriti is uh, particularly inclined to certain kinds of diseases, it's always possible to move that person away from such predilections by a proper lifestyle, by certain counseling, certain lifestyle, certain dietary uh, additions, etc. So, can the Vikriti change based on the environment, based on people around you? Certainly, yeah. And also, this is not just restricted to lifestyle, it's also restricted to the kinds of interactions you tend to have with people around you. So, if you are in a very hostile environment, then certainly that can affect you. And one sees this also quite often. I'm sure we've experienced it in our lives. That I mean, I think one of the cases that visited our hospital was one where the person had just been kicked out of his job or had had a very traumatic experience at his professional place. He was already an asthmatic. So he came to us, in acute respiratory emergency. I mean, completely couldn't breathe. So, I mean, can the environment affect you? Certainly, yes. Can it affect the Vikriti? Yeah. Can it affect the Prakriti? I would say no, because I hope I answered the question.
Okay, thank you, Guru, and thank you, Pushya. Uh, we have another question from Dilip. If you would like to ask it, we can take it. It is about whether you could throw some light on the connection of Ayurveda with yoga.
Yeah, I mean, like I said, Ayurveda and yoga have they have a very close link for the simple reason that I think they've also both been born from the philosophies of this land, and in the sense that they're also rooted in an Indian subcontinent understanding of well-being, health, spiritual growth, etc. And um, and I think the beauty is that they're also not restricted in any way, because they've both been derived from a very wide and diverse praxis. So there's been no race restriction, no ethnicity restriction. I mean, certainly if one was to look at both texts, that has also not been there. So in that sense, it has belonged to the people. And I think that that is certainly one commonality philosophically. In other ways, I think certainly, I mean, Ayurveda mentions asanas and yogas in particular contexts. Um, and also, I think maybe one of the biggest links between Ayurveda and yoga is this understanding of prana, because yoga also believes that prana is the I'm not able to immediately get the reference. It's from the Hatha Yoga Pradipika, which says, I'm sorry, I'm not able to remember, but it is this that which speaks about how it is the prana that is responsible for all action, and where the prana goes, there does the mind go. I don't know if anyone knows that, and I'd be grateful if they could share it. But that where the prana goes, there does the mind go, and where the mind goes, there the body goes, and then sasana is formed. So definitely there is a very deep understanding of the 72,000 nadis, or the various pranas, the Dhananjaya prana, the Upapranas, the main three pranas which flow in the Ida, the Pingala, and the Sushumna. So Ayurveda borrows a lot from this understanding of prana, or also possesses, I wouldn't say borrows. And it looks at it also physiologically and what the functions of these pranas in the bodies are. For example, the prana, udana, samana, vyana, apana. So I think this understanding of prana, which forms one of the foundations of an Ayurvedic and yogic understanding, is an important similarity.
Thank you, Dr. Pushya. We have another question from Mr. Ubendra. So, would you like to ask your question?
Of course, you have answered all the questions, and I have got the answer. In spite of that, I have this a little layman kind of question. That is, a shastra has formed on the basis of the understanding of the life, philosophy, body, and other things, right? So now, totally there is change in everything. I mean, in the nature of the individual, nature of the disease, and everything. So then there might be any possibility of rethinking the Shastra itself, because the philosophy of life has changed, the nature has changed, and the disease also, distorted diseases, and then even practicing of something, practicing of life also changed. Then the Shastra has to be changed. I mean, it's very ignorant. I mean, no, totally the Charaka has to be changed. In that sense, I am going.
I fully understand your question, sir, and I think that it's a very, very, very interesting and pertinent question. Thank you so much for asking this. Sir, I feel that in any science which is 5,000 years old, I mean, I'm not only talking about Ayurveda, I'm talking also about yoga, I'm also talking about, homeopathy is more recent, but Siddha or Unani, which came, at least texts belong to later. Chinese medicine for sure, which is dated as early as Ayurvedic medicine, Tibetan medicine. I think that the challenge, for instance, there would have been several modifications, several things, and I agree with you that there are parts of the text, there are parts of what have come that are irrelevant to today, because they were written in social context 5,000 years ago that in many ways have no relevance to where we are today. For instance, they were written, you can clearly see in the Ashtanga Hridayam, which was written by Vagbhata, that he has written certain things that can only be performed if one was to look at even the dinacharyas which have been mentioned. They speak about activities that a king can do because they were written for people of that caliber, people who were patrons, people who were rich, people who were kingly. So often those things, I mean, the context in which they were written have no relevance to today. There are certain context specific references also. For instance, how he speaks about, for instance, in the evening in the palace, in a palace made of, or in a mahal made of sandalwood, for instance. Now there is a reference like that, which has no significance to today. But I think, and I fully agree with you when you say that these parts need not be carried forward to today, which I think has anyway happened. And I think if there is one, the biggest, the biggest and the most cruel critique perhaps is the critique of time. So I think time has weaned away a lot of things that were relevant at a time, but are not relevant to today. But at the same time, if it has continued, if some parts of it have continued, for instance, if a perspective of sustainability, if an understanding of holism, if a grounding in, an anchoring in a non-anthropocentric look at health and well-being, or at a more holistic understanding of one's own connections and interrelationships, which is what it is based on. Now, these ideas are certainly relevant. And also this idea of using herbs, using plants as medicine. Now, this is again coming back, especially in the context of antibiotic resistance, in terms of several other paradigms. There's a reason why people have looked back at sustainable and more body unharming alternatives to contemporary medicine. So I feel that if they have survived this long, it is not because people have, or a certain group of people has wanted them to survive, but the fact that the time has needed them. And the parts of them that were not needed have anyway become irrelevant. and this would have happened not once, not twice, but several times over 5,000 years. I mean, I mean, and they've passed the critical gaze of countless civilizations, countless races, and I'm sure that it is only what is required, what people bring back, that stay relevant. So that would be my understanding, and on the ground, that is my experience as well.
Oh, very nice, madam. Very great. Thank you very much. It's a very great answer.
Thank you, sir.
Thank you both of you for that question and answer. So now, since we are also running short of time, we will take more questions in the WhatsApp group. Thank you everybody for asking such pertinent questions, and thank you Dr. Pushya so much for this beautiful presentation. Also have to thank Sankita ma'am for giving us this opportunity to give these lectures in this series. And thank you Niharika for the tech support, and also Abhishek and Ashwini. Thank you again, all of you. On 15th, we have another lecture by Hari Shankar. Hari Krishnan. He is a engineer by profession, and he will be talking about machine learning and how intelligent machines learn from experience. So please do come for that as well. Thank you, everyone.